My name is Khalil.
Admittedly.
Hi, everyone. We will now continue with our journal portion club of our SLS meeting for tonight. Our first presenter will be Ms. Jasmin Strong of the University of Southern California, presenting Mechanisms of Traumatic Shoulder Injury in Elite Rugby Players. Jasmin, would you like to share your screen now?
Yes, absolutely.
Thank you, Jasmin.
Just going to take me a second. To fix the portion of my screen showing. Actually, you know what? Sorry. One moment. Okay, can everyone see my screen? Well,
Yes.
Okay, thank you. So thank you, Lauren, for your introduction. As you mentioned, I'm Jasmin Strong. I'm a graduate student at the University of Southern California. And today I will be presenting a paper entitled The Mechanisms of Traumatic Shoulder Injury in Elite Rugby Players. This study was written by James Chricton, Doug R. Jones, and Leonard Funk. The paper was published in the British Journal of Sports Medicine in 2012. The British Journal of Sports Medicine has an impact factor of 12.68 as of 2019. So for some background, the shoulder is a frequently injured joint at both the amateur and professional level in rugby union and rugby league. And just for some quick information regarding rugby union and rugby union is what we typically refer to as 15s, or involves 15 players per team on the field, and rugby league, which I just found out recently, is 13 players. So that's a little factoid. So tackling is a highly mentioned mechanism of injury, with studies attributing about 49 to 72% of shoulder injuries to the tackle. Heedy et al. In 2007 attributed 65% of shoulder injuries to the tackle, falling within the range previously mentioned. And this was in an English professional rugby football union club population and monitored over 2 seasons. So common shoulder injuries facing players include, but are not limited to, dislocations and instability, acromioclavicular joint injury, and rotator cuff injury. While the shoulder injuries are well documented in the rugby playing population, the exact mechanisms and arm movements causing the injuries are less understood. With that being said, the aim of the study was to elucidate and describe patterns of shoulder injury, mechanisms in elite rugby players, and to correlate these injury-producing mechanisms with specific identifiable patterns. As for their methods, the study population consisted of 24 professional rugby league and rugby union players from the ages 19 to 35, who had all sustained shoulder injuries within a match and had been referred for diagnosis and treatment to the lead author, who's also a specialist shoulder surgeon. Since the referral was special and to a specialist surgeon, they all suffered rather serious injuries. As for the methods, the investigators utilized video analysis of the matches to determine the mechanism. These videos were reviewed independently by rugby medical experts, which is the phrase they used within the paper. And this included orthopedic surgeons, a sport medicine physician, rugby physiotherapist, and a few others. The rugby medical experts were asked to fill out a pro forma for describing the injury while watching the video, focusing on identifying variables like body position, arm at initiation of injury, how the arm moved during the injury, like such as flexion or abduction, and the direction of the the direction of the force on the arm, so like anteriorly or posteriorly. Using this information, the investigators were able to identify and name 3 common mechanisms of shoulder injuries. So to start, first we have the tri-score. The tri-score is characterized by the arm flexion above 90 degrees and a posterior force driving the arm backwards and exerting leverage on the glenohumeral joint. Should be there. This is common when the players would go into score a try. However, within the study, it occurred mostly in players participating in a tackle, whether it was during a tackle, whether the player was being tackled or tackling was undisclosed, I believe. Secondly, they identified the tackler. So that would be this player here. And this was an injury to the player as they attempted to make a tackle and they made contact with the ball carrier. And the contact with the ball carrier was driving their abducted arm posteriorly. Again, exerting leverage and force on this glenohumeral joint here. Lastly, we have the direct hit, or the direct impact as it's sometimes referred to within the paper. And this was characterized as the ball carrier taking a direct impact to the shoulder as a result of the player tackling them, or a direct hit to the shoulder as a result of being tackled, and that impact occurring with the floor or ground. The arm is in an abducted position as it's holding the ball, and it faces internal rotation and a medially directed compressive force when making contact. As for results, the most common injuries seen in the population overall, so regardless of which mechanism, was glenohumeral dislocations occurring in 67% of the players and anterior labral tears occurring in 71% of the players. And these labral tears were often associated with the dislocation, as well as rotator cuff tears also being associated with the dislocation. Specifically, the tri-score and tackler's mechanism were highly correlated to these injuries. And then while the glenohumeral dislocation and labral tears were also present in direct hits, what's notable about the direct hit mechanism is that they were the only mechanism in which scapular fractions and acromioclavicular joint dislocations occurred. So for the discussion, for the findings, the tackle was associated with 71% of shoulder injuries, and this was comparable to the literature as previously mentioned within that range. And they also identified hyperflexion and internal rotation as a cause of dislocation, as opposed to just the acknowledged abduction and external rotation of the arm. As for suggestions or interventions that the authors noted, they encouraged to avoid tackling with solely an outstretched abducted arm, and to make contact with the player that you're trying to tackle at the shoulder. And this will limit that posterior force on the abducted arm, as the whole body is usually more behind the tackle in that case. And then they also noted to avoid diving to the try line with outstretched flexed arms, and just maybe place the ball for a try instead. As for limitations, one was the quality of the video footage. They noted that at certain times, the injury or the player that was being injured was obstructed by other players, and at other times, the injury was only assessed using a video from a singular camera angle instead of multiple views at the singular injury. The study also only looked at injuries occurring in a match or a match play as regards to training. So that's limiting ability to see shoulder injuries that potentially happen during strength and conditioning or skill training. And again, this is an exclusive injury population. So as mentioned, the lead author was a specialist shoulder surgeon. So that really limits the ability of this study as a representative study representing, sorry, that was a lot of repetition, but as a study that can be representative of all shoulder injuries occurring within a rugby playing population. These are my references, and thank you. If you have any questions, that'd be.
Thank you so much, Jasmin, for your presentation. Would anyone have any questions for Jasmin or Dr. Lopez? Would you like to comment?
No, I thought it was a really good study, especially evaluating the mechanisms. I think some of you have already seen in some of our work that we're trying to look at the mechanisms of the shoulder injuries and things of that nature. Again, strong work. Thank you very much.
Thank you again, Jasmin. Can everyone see? Next, we will be moving on to Mr. Ericjon Sero, who is a student at Stonybrook University. He will be presenting a paper titled Road to Rio, a case study of workload periodization strategy in rugby sevens during an Olympic season. Eric, would you like to now share your screen with us?
Yeah, no problem. All right, can everyone see my screen?
Yes.
Yes, okay. So thank you for the introduction, Lauren. I'm actually a graduate of Stonybrook University in 2019. My name is Ericjon Sero. I will be presenting a paper written by Robineau and co-authors titled Road to Rio, a case study of workload periodization strategy in rugby sevens during an Olympic season. And this was posted in the Frontier in Sports and Active Living journal in January of 2020. Okay. So the elite rugby sevens season structure is divided into 3 macro cycles during an Olympic year. It starts with the preseason and is followed by the World Rugby 7 series, which is around 25 weeks and is broken into 4 to 7 week cycles. And at the end of each cycle, there's 2 tournaments played in consecutive weeks. And this is followed by the Olympic preparation phase, which is around 12 weeks. So the authors believe that the welfare, recovery, and physiological condition of rugby players are likely negatively influenced by the World Rugby 7 series. The reasons they believe this is because the World Rugby 7 series requires a lot of rapid long distance travel, which can lead to jet lag, which can affect the player's sleep, fatigue, and mental status. A study done by Marrier and co-authors found that there was a decrease in available players and well-being scores during the middle of the in-season. Another study found by Mitchell and co-authors found that there was a reduction of lower body maximal power and strength across the entire season. So only up to this time, there was only 1 study done on training periodization of rugby 7 players in the World Rugby 7 series, and there had been no studies done on the training load undertaken by rugby 7 players across the entire season, including the Olympics. So the objective of this paper was to analyze the training periodization strategy of an international rugby sevens team during different phases of an Olympic season with measures of external and internal workload. So the study was done over 48 weeks during the 2015-2016 Olympics. Their sample was 14 professional athletes on the French national rugby sevens team. They measured internal training load by asking the players to give a rating of perceived exertion 30 minutes after training or match play on a custom designed app on their smartphones. They used this to minimize bias that players would have if they would replicate other players' scores or would be peer pressured into their rating. And they would multiply this rating by exercise duration to get the internal training load. They measured external training load in training and competition using GPS devices. So they would wear a vest or the device would be placed in their jersey. And this would measure metrics such as total distance covered, high intensity distance, which is the distance traveled above their maximal aerobic speed, and this was individualized for each player, and the number of accelerations. So both of these figures shows a schematic of the entire season, Olympic season, and as I mentioned before, it's broken down into 3 macrocycles, and the in-season is divided into 4 mesocycles. So on the left-sided figure, you can see that training load is on the y-axis and the number of weeks is on the x-axis. And the shaded region just shows the end of each cycle. So you can see that during the preseason, the training load was very high, and then it declined a little bit in the in-season and then rose again during the Olympic preparation phase. And on the right-sided figure, they labeled the priority of each tournaments in order of importance. So the normal World Rugby 7 Series tournaments were the least important and given the number 3. The home tournament was the second most important and given the number 2. And obviously the Olympics is the most important and given the number 1. So they performed a statistical analysis using R statistical software and then did a data analysis using effect size or Cohen's d, which is basically the difference between 2 means, and it gives this in standard deviation. So it tells you the amount of standard deviation between these 2 means. So the means that they were comparing was the first preseason compared with the in-season as well as the Olympic preparation phase. And what they found was that the internal load, which was the rating of perceived exertion, and the high intensity distance were greater in the preseason compared to the in-season. They also found that the total distance and acceleration were greater during the Olympic preparation phase compared to the preseason. They also looked at the training loads within the competitive season. And what's here to note is that during the third cycle, they saw that the internal load as well as the measures of external load, such as total distance and high intensity distance, were lower compared to the first week. So the preseason is a crucial time frame to plan and prepare for the Olympics. The staff implemented a high training load to build a strong neuromuscular base for the players. A study found that the more number of preseason games that a rugby player played in, they had a lower likelihood of injury during the competitive season. It was also a time to anticipate the Olympic preparation, the Olympics, and select a periodization strategy to be used during that phase to optimize peak performance levels. In the in-season, there's a shift in training focus with the Olympics in mind. So they're more focused on managing the training load of their players and focus on player recovery. So what they did was lighten the workload mid-season during the third cycle, which explains the decline in internal and external loads during this time frame. They also skipped the last tournament of the World Rugby 7 Series because they determined that it wouldn't have much effect on their general standings in the competition, and they were more focused on preparing for the Olympics because that was more important. So the outcome of all this was training availability of 100% of squad players at the beginning of the Olympic preparation phase. And now onto the Olympic preparation phase. So again, you're implementing a high workload program. You want to target optimal fitness levels for the Olympics. They also wanted to keep the rhythm of competition by having tournaments and exhibitions. So they hosted 2 tournaments and 6 exhibitions with intensities greater than real game demands to simulate the competition of the Olympics. It also was a time for them to acclimatize themselves to the heat conditions in Rio de Janeiro. So after each training or after each match, they would hop into the hot bath or the sauna. And the results of all the preparation was a 7th place finish in the 2016 Olympics, which is not too bad. They did better than the US. So it just goes to show that the workload periodization strategies are important for the success and longevity of rugby players. And this study is kind of interesting because it was the first of its kind, because rugby sevens was played for the first time in the 2016 Olympics. And it's important to note because the 2021 Olympics is next month, so it's right around the corner. So one question I want to leave you all with is, how can we measure workload more accurately? Because I feel that asking players to give their rating of perceived exertion on a smartphone app is not the most accurate. And they also found that using GPS devices to measure external workload, they weren't able to get data for 2 of those tournaments because the stadium structure wouldn't allow for the satellite signals to reach the devices. So for those 2 tournaments, they had to extrapolate already used data based on the average variation between the first and second tournament. So just something to think about. Here are the references I used for this presentation. Thank you guys all for listening. If you have any questions, I will be glad to do my best to answer them. Thank you.
Thank you, Ericjon, for your presentation. As he mentioned, we'll now open the floor to questions or any comments.
I have a quick question. It sort of relates to how this year is different. So because the Olympics were obviously delayed due to the COVID pandemic, it's clear that this type of study and implementing this type of workload periodization is important. Do you think that something like a delay like this would interfere pretty significantly with an athlete's ability to, be properly prepared for their competition?
That's a great question. I do agree that the pandemic definitely altered players, because weeks there or months of inactivity has been shown to have increased risk of injury. And I'm sure during the pandemic, not everyone, especially these players, were not training for the Olympics. They were more focused on the pandemic.
Thank you.
So, can you hear me? I'm sorry. No. Okay, great. Yeah, great job there, John. John. The question is that which team skipped the quest for gold, or the South Africa had a round robin with Australia and New Zealand pre-Olympic. So what did the other countries end up doing to increase the workloads or to approximate workloads appropriately? As we discussed, I think some of the best work by Gabbett and Wint on the workloads are important to understand. The question comes down is that which teams missed? So basically the first question I would have asked, if this was a normal year, which obviously all of you are not in New York and doing this via telecommunication, it's not the normal year. So what team do you think would have skipped the last match of an HSBC 7 series? The issue comes down to if your city, Cape Town or Vegas, which is now LA, was the last of the cycle, you don't have that opportunity to skip the event or cheat your fans. You actually have to play. So it's kind of unique that they did disclose that. Furthermore, that they did disclose that the limitations that they had to approximate from the other events, the workload, and that's probably 2 major limitations on this paper. No competitive team or athlete wants to say that they cheated. That's something, no one really wants to admit to. So that's a very unique thing that opted not to expose their players to the last bit of the window of the HSBC 7 Series to try to save or prevent players from being injured prior to the Olympics. Now, again, that's a strategy at the time, and a strategy that probably other teams do employ something of that nature to try to get that extra edge. And when you're in that kind of competitive arena, you try to, maximize your abilities. But again, I think it's very unique in that aspect. Now, in regard to the question, Ericjon, that you were asking about RPEs, and I think we have to probably defer this to Ms. Tara Condon, who gave us the talk on Wint and Gabbett and RPEs, and she did her master's degree on RPEs and the use of them and the validation of them. At the moment, that's what we have. But in regards to external workloads regarding match performance or game performance, GPS is the best one that they're using at the moment. But regarding internal, RPEs are kind of what they're currently using as a standard, which is actually a question, a subjective question-based, interview. And you just have to take that and use the best science that we use. And I guess you could say that's exactly what we do as well. We use the best that we have from our data and use the best science that we can apply.
I'd like to thank you again, Eric. One moment, please. Next, we will be moving on to Mr. Obafemi-Michael Animashaun of NJMS Rutgers Biomedical Health Science School of Graduate Studies. He will be presenting Sports Medicine Diagnostic Coding System in the Orchard Sports Injury and Illness Classification System. Obafemi, would you like to share your screen with us now?
Good evening, everyone. Thank you, Lauren. Close this here. So today I'd like to talk about the coding systems used in sports medicine. And it's actually an interesting history reading through this paper of how sports medicine compares to traditional medicine in coding and its epidemiology and statistics. So historically, sports medicine hasn't had any surveillance and research, except for starting in small projects in the 60s and 70s. And then going on to the 80s, it became more of a widely used research study. And using the traditional coding of medicine, the International Classification of Disease, it was pretty difficult because those codes and those diseases that were standardized were focused on mortality and morbidity. Now, that doesn't say that these injuries or illnesses didn't arise in sport, but that's not normally what happens. So in 1988, the American Journal of Sports Medicine was the first to come out with a standardized injury and illness surveillance system that had incorporated multiple components, such as the population and cohort of the sport, or the definition of an injury and the classification of how those injuries arose, as well as the mechanisms and the severities of those injuries. So as I mentioned, the International Classification of Disease was the main reference for coding different illnesses and injuries. And then going on to 1991, the University of Calgary developed the SMDCS, which is also known as the Calgary Code, that incorporates a fundamental basis of anatomical tiers, which which incorporates the different regions of the body, and simultaneously the Orchard sports injury classification system, the OSIICS, was also being developed. These two classification systems before this paper was the standard for classifying sports injuries and the within different realms of sport. And also, I'd like to mention that the history of the ICD, which incorporates a more of a in-depth understanding of illnesses rather than injury, has about 55,000 codes to reference, while the SMDCS and the OSIICS has around 750 to 15,000 codes. So you can see the discrepancy in those two areas of medicine. So currently there's been an update to the ICD. We're on ICD 11, which will be implemented in 2022. And that update incorporates more sports injuries and illnesses, but it is still centered around mortality and injury illnesses and of the same nature. But in this paper, Orchard planned on developing the original injury system and incorporating illnesses as well. So the accuracy of these standardized formats have developed into what I would like to explain into the next slide. So in Orchard's new classification, they would like to split and define what's an injury versus illness in sport. So for example, a concussion is an injury, while migraine is an illness, or a bruise is an injury, but a fungal infection that leads to like an open wound would be considered an illness. And that's one of the discrepancies between the older classifications, that it's difficult, and it still is, even with this new update, that classifying certain injuries is hard to do. So on the screen is an image of plantar fasciitis, which in the paper is mentioned as can be classified as both an illness and an injury, because it is a skeletal muscular irritation, but it's only irritated through external activity. So here are some definitions of what injury and illness was used in the study, is that tissue damage or other derangement of normal physical function due to participating in sport, resulting in a rapid and repetitive transfer of kinetic energy. And then illness is a complaint or disorder experienced by an athlete not related to injury. So you can see how the two different definitions will still collide depending on what that injury is. And actually, I was going to mention to Dr. Weinstein of whether he considered myocarditis more of an injury or an illness, just because the onset of those symptoms can be seen more often in physical activity. So going on to the updates within including injury as well as illness, Orchard included 3 dimensions of categorizations for injury, which includes the body part, the tissue type, and the pathology. And for illness, they incorporated the two dimensions, which is the organ system or region, and the etiology, which is the cause of the injury. And I would like to challenge you with the information that I just provided of how would you categorize these injuries. On the left, you have Giannis, who got hurt in the playoffs. If you've been watching the NBA playoffs, he got hurt landing down onto the court. And to the right is the Tour de France, where there was a pile up. Athletes came out injured in that instance. So if you have any suggestion or inclination of how you would categorize these injuries, whether it be the body part, tissue type, or whatever etiology may arise, go ahead and unmute yourself if you'd like to.
Well, that's an open-ended question. I think the Tour de France, everyone got hurt, spectators and all, even though the cause was due to a spectator. So we'll skip that. That's a very unique. No, great presentation. Does anyone have questions for Oba? Well, I'll bring something up. When they did the two-dimensional to bring in the respiratory and the cardiovascular, I think I'd like to say that I had something to do with that, because when the IOC sent me an interview to discuss what I thought of the categorizations, and I explained to them that they did not have something that directly addressed exercise-induced asthma or exercise induced bronchospasm. We had 2 or 3 of those cases at the National Club Championships, and I explained to them, I said, isn't it due to the fact that the cause was due to the sport, therefore it's considered an injury due to its etiology? Again, a fair enough question. Now, Oba, now that you've gone over that, do you feel with the specific injury that I just presented that it still falls under illness? Well, obviously the way they structured it with their two-dimensional under a respiratory case, it's an illness.
Yes, I would categorize it as an illness, but not, I'll do it more broadly. I feel like there should be at least an additional characteristic that says that this was induced by physical activity, because that's not, like, as you mentioned, that's not the only etiology that can arise. The plantar fasciitis, the heart diseases, or even having a concussion, like those things that are concussions that lead to other elements, that those things need to be specified, especially if it's turning into an epidemiological study or something that needs to be statistically sound.
Thank you. Yeah, I agree.
Well, thank you again, Oba, for your presentation. This is the end of week 4 of the summer lecture series. I would like to thank everyone on our conference call and our Zoom meeting. And now we will continue with the rest of our evening. Thank you.